just want to spend a second talking about well body training for a second. So theoretically, before surgery, you already have a physical practice, a muscle contraction practice, or cardiovascular based practice. But if you don't, that's okay too. It's the perfect time to start one. And really, the only way we can get into trouble here is we end up moving our tissues at speed, or we're loading something that shouldn't be loaded because the physician has asked us to be non-weight bearing. So in short, remember that we can always slow things down. We can seat. It's okay to use one arm. You're not going to get one arm that's really big and one arm that's really small. The research supports, of course, that any movement input is going to be healthy to the system, whether it's about accumulating enough non-exercise activity fatigue that you can actually go to sleep in the evening, whether it's just holding on to your current gains. We talked about setting some sort of unrealistic goals and expectations early on, but remember that even doing single leg squats or assisted squats on a single leg or hinging on a single leg is net positive input to the body. And that neuroendocrine response, that release of testosterone, release of growth hormone, all those things in the well body are going to feed forward and help that other body. In fact, your nervous system is pretty clever about saying, well, if we're getting stronger on this quad, we better get stronger on this quad as well. So there's definitely cross and carryover. If you ever need help, go hire a coach or a trainer. If you are really concerned, go jump into a Pilates mat class, move slowly, develop this time and intention. What you'll see is, as we've talked about setting a goal and working backwards, most rehab is actually just about hitting sort of these tissue tolerance, tissue healing time frames, and making sure that I have the appropriate range of motion in those things, not to disrupt sort of the healing process. Whether it's just putting my arm over my head and then keeping my arm over my head as I walking lunge, and then keeping my arm over my head with a 1 pound weight, and then pretty soon you see that it's all progressive overload. And this time is one of the reasons that we, in our personal experience, for most recreational athletes, don't do a lot of heavy periodization. Because travel, sleep, injury, surgery, all of those things are going to disrupt your normal process. So you can see that these next couple of weeks we can consider them as like a significant deload week, and that we're going to begin to just control what we control. A long time ago, one of my coaching mentors said, when you get dealt the hand of the specialist, become a specialist. So it's totally okay that you've taken things off the table. You're going to get sick of one-legged burpees. You're going to get sick of three-armed biking. That's okay. But keep that well body training as part of your rehab process. We cannot emphasize that enough. And going to rehab or going to physical therapy and doing the prescriptive exercises there is not enough. You must keep that body and tension under load to maintain your muscle mass and maintain the integrity of your connective tissue. And basically, we just pretend like we have one limb or system that we're needing to unload while the rest of the system is making progress, and we drag that limb along. So hopefully that makes sense to you. And again, you can do a lot of upper body work seated, and if that's the game, don't even worry about it. You'll be back before you know it.